The Federal Ministry of Health says it will leverage on the Value for Money initiative of the World Health Organization to boost healthcare delivery system in Nigeria. The Permanent Secretary of the Ministry, Mr. Abdulaziz Mashi, said this at the maiden edition of the WHO African Region Value for Money Training of Trainers Workshop in Abuja. Mashi, who was represented by Dr. Emmanuel Meribo, Director, Health Planning Research and Statistics, said with the ongoing reform in the health sector, Nigeria would benefit enormously from the intervention. According to him, Nigeria is currently implementing a number of health financial reforms which will help to redefine and shape the course of the nation's universal health coverage aspirations and the sustainable development goals.
With the ongoing reform in Nigeria, we stand to benefit enormously from this intervention. It is my belief and desire that tools, applications, and skill set from this workshop will enable my officers to translate the ongoing reforms to impact positively on our health system. The government of Nigeria is currently investing additional domestic resources amounting to over $180 million annually, and this will be in perpetuity as is now a legal issue. In addition to her annual budgetary allocation to health, this money will be spent mainly on primary health care for primary health care purposes. The purpose is to aggressively improve on our current health indices, as well as ensure a sustainable and efficient financing for health. Considering that we have limited resources for a vast number of health demands, the need to ensure strategic prioritization and value for money for every naira spent cannot be overemphasized.
Dr. Peter Lasuba, Officer in charge WHO in Nigeria, said the workshop was in line with WHO Afro-Transformation Agenda and the overall WHO reform. He said that the training would further illustrate his organization's commitment by ensuring that all activities encompass health gains for every dollar and boost the capacity of the trainees, who would facilitate the rollout of the initiatives in their respective countries across the region.
Training of Trainers Workshop is a follow-up to the RPM, and it is in line with the Afro-Transformation Agenda and the overall WHO reform, and it demonstrates WHO's commitment by ensuring that all activities encompasses health gain for every dollar spent. This training is therefore the first in the African region and is expected to catalyze the cascading of value for money implementation in all the countries in the African region. It is expected to enhance capacity of trainers who will facilitate in the rollout of the value for money and operational planning in their respective budget centers or their respective country offices.
For his part, Mr. Francisco Katayama, representative of the Director, Program Budget, WHO Africa Regional Office, said that the workshop was about emphasizing the value of money in all WHO activities. Katayama pointed out that through the initiative, emphasis would be given to the most vulnerable and marginalized, especially women and children.
This is a training of trainers. From here, each of the participants will be going back to the country offices, and then they will build the capacity of our colleagues in the country offices. One of the principles of value for money is about equity. And equity means we would be giving emphasis to people who deserve the most, who are also marginalized or not given the opportunities or access to health care. And most often than not, the women, the children, these are the people who need the support. So in our value for money analysis, equity is an important parameter.